Don't know if you know much about the Victorian Health Promotion Foundation, but Vic Health has worked for the last 21 years since its inception to link the characteristics of our living environments with their impact on people's health. We work across a varied area, and certainly in doing that over that time, I've posed some questions that have been recurring themes. Evelyn's alluded to the nature of the characteristics of healthy cities that we've known about since about the same time. And it's timely to think now, what do we really want our cities to provide? And then also, who's responsible to make that happen? Is it the government? Do professional groups have a role? The private sector? The community? And if that's the case, whose role is it to act as an advocate? And what skills are needed for people to be able to do that? And also, it's timely to think about, can healthy choices really be easy choices to make, depending on the types of structural barriers that we face in certain communities? This is a very busy slide, and I hate busy slides, but to do justice to just a snapshot of some of Vic Health's work, past and present, in our efforts to support healthy communities, the Healthy Cities philosophy has influenced many of our activities and continues to do so. So some 20 years ago, we were involved with the Healthy Localities project, then with the local government in leading the way, producing a planning tool or a tool for local government use. We have worked with the Planning Institute of Australia with a project called Putting Health at the Centre of Planning. ICLEI, who we're about to hear from, with regards to a tool for active transport. With the Growth Areas Authority, a project around creating livable new communities, and certainly in the arts and environment area, the vital importance of health in public spaces. We know that the type of spaces that we have around us are conducive to both physical and mental health, and that's extremely important. Areas like the local environment also need to be made attractive for younger people for walking and activities such as walking to school. So the Walking to School bus has been an initiative that Vic Health has certainly got up and running, and now its successor, the Streets Ahead program, is going ahead, which is fantastic. We've been involved with a lot of submissions which are aimed at the legislative and the policy approach to creating healthy cities. So whether we're talking about livability for Melbourne 2030, what our land and biodiversity are doing in a time of climate change, and transport frameworks. There's a range of different areas that we are always giving advice and feedback to government. And another very important area, particularly to increase the evidence base, is the funding that we provide for fellows, scholars and for conferences. So all in all, we need to get away from we need to get to a triple bottom line decision making where we are actually taking into account environmental and social outcomes rather than just economic decisions based on the dollars involved. We need to come into the look at the opportunities provided by their prevention agenda, because they're actually talking about reshaping our urban environments to have a better and more preventive effect on preventing chronic illness. Climate change, we're certainly in that area with some developmental work, and that's certainly an area that a lot of people will be talking about this evening. And we need opportunities to feed into legislation like the review of the State Planning and Environment Act, because we just have to have the environmental areas linked to health. And finally, there's a leadership role for some organisations and government to create and share the vision we have for healthy cities. Thank you.